I've had my coffee. I'm ready to go.
Yeah, me too.
Alrighty, let's
All
do
right,
it.
Tanner, you doing the opening? I'm doing the opening.
You do the.
I think
I'll do-
David should do the
You
opening.
want to do the opening, David?
What's the opener?
You didn't watch. I thought you
I do,
were
but
an avid
I don't
watcher.
have it memorized.
David's
though.
our biggest fan.
I do love the podcast. Welcome to the pod, presented by Northwest Health Services.
I'm your host Corey,
I'm your other host, Tanner.
and we're back. This is our 5th episode.
5th episode. Dang.
I know.
Where's the time going?
We're rocking and rolling.
We
On a
really
roll.
are.
We also have Bodie. You can't see him. He's our marketing intern for the summer, behind the scenes today, watching. So welcome, Bodie. You're welcome to come in and be a part if you get the itch. You can sit right there with no headphones and no microphone. You can just scream. Anyway, we have 2 guests today on today's episode, and Tanner, you want to do introductions?
Yeah. So to my right over here, we have David Lopez.
Yes.
David Lopez. I don't know how to say your-
David Enzeres Lopez.
David
Enzeres.
Enzeres Lopez. We have David over here. He is a community health worker, and he resides at our Southside Health Clinic.
Yeah, he lives there.
He lives not. He doesn't actually live in the
I
clinic.
do live on the south side.
Yes,
So, yeah.
so it is convenient. And then we have over here, we have Tina Cook, who is another CHW with additional title.
Health Train Coordinator.
Health Train Coordinator, yes, because I knew we had to redo her nameplate.
Oh yeah,
So I knew there was extra to that. But
yeah.
yes,
She nitpicked us.
I didn't. Mitch did.
blame Mitch.
He did. I didn't say a word about it.
I'm just giving you a hard time.
Mitch is the one that
Yeah.
said it. Got to be correct.
We got to know David and Tina pretty well last year. Well, I've known Tina for a while, but David, you've been with the company about a year.
About a year. My anniversary, 1-year anniversary, was on the 1st of June.
Yeah.
Oh, okay. Well,
So 1 year.
congratulations.
Thank you,
That's
thank you.
awesome.
That is awesome. 1 year.
Mm-hmm.
That doesn't happen very often in today's world.
I'm working on my 20th.
Wow.
Dang.
You haven't hit it yet, but this is
well,
your 20th
May,
year.
I'm working on. Yeah, I'll be
This
here
next-
20 years in May.
Next May. Wow. That's crazy.
I know.
Well, you're just about to hit your 7th.
Yeah, I'm about to hit my 7th.
Okay.
It makes me feel old.
I remember when he came aboard.
Yeah.
Tina, you started at Northwest. Which department? Can you go through where you?
Yeah,
the
I started
changes?
as a collection specialist in the billing, and then I went from that to billing insurance. After 14 years of that, I needed to do something else, so we opened up our downtown clinic, and I started the Medicaid and helping those patients get Medicaid and Social Security disability if they needed it.
That's right. I remember that.
Yeah.
And now you're a community health worker.
And yeah, I got that as I was doing that, my community health care.
Because for those of you that don't know, the community health worker positions are grant funded, and there's a class you have to take to become a certified. Is that what the word is? Certified?
Yes,
Yes,
correct.
and then you can go on and get credentialed.
Gotcha. Are
which
you
we-
guys?
Yes.
You
we're-
guys are doing
we're
that?
both.
We're
Certified.
both. We're certified and
And
credentialed.
credentialed. Yeah, look at you
How long
guys.
does the class take?
I would say about a semester, right?
About 6 months.
6 months.
Oh, okay.
Wow. And there's like homework and stuff from what I've heard.
Yep.
Yeah.
My wife was the very first community health worker that Northwest had,
Yeah.
like
Wow.
4 or 5 years ago, and she had to take a class. And it was funny because I'd come home. I worked here as well. I'd come home and she'd be like, "Yeah, I have homework for work." I'm like, "Nah, it sucks."
Yeah. It's not
But-
too bad though, but
Yeah,
It's important though.
but it
for
does
sure.
take a while. And you guys, David just recently got yours, and then
I've been a community since 2018.
yeah, that's crazy.
I know.
And Northwest has had community health workers. Let's see, I want to say since 2017 is when.
Yeah, she would have came in about a year before
Yeah.
me.
So we've had the grant for, I'm just gonna say 5-6 years now. What do you guys? What's your role? Like, what does a community health worker do?
Yeah.
Oh, many things.
What's a general overview of?
we focus on the social determinative health of our patients. Plus, we're involved in the community. It's not really restricted to our patients. There are people that flow in that need our help, and then they become our patients. But just whatever is needed,
Yeah.
you know, housing, food, you know. I gave my bed away to somebody the
Oh
other
yeah,
day.
yeah.
Your
Well,
I
bed.
did not expect you to say that.
Literally, because she was homeless and she finally got an apartment and she needed a bed, and I was going to get a new bed, so I just gave it up a little earlier. But
That was nice of you.
That's really
yeah,
nice,
but
yeah.
just wherever the need is.
I was
we
going to say, are you
just-
sleeping on the floor?
I was sleeping in the recliner for about
Oh my gosh, that's even worse.
a couple weeks, but it's all right. It was all
Dang.
good.
Could not be me. But hey, you did it.
I'm just saying there's just needs.
Yeah.
for sure. Absolutely.
You know, if they're not sleeping well, or they're out on the street, or they're hungry, they're not going to have good health. You know,
Yeah.
so that's where mainly our focus is we want our patients to have good health
Yeah.
all the way around.
David, did
So-
you have something to add?
Yes, I would say we're like generalists. We do a lot, but it's not necessarily medical. Like we don't do
Right.
really anything medical. Kind of like what Tina said. We just address like anything that is non-medical that could be like a barrier to accessing healthcare.
Yes.
So whether that's transportation, whether that's you don't have insurance,
Yeah.
or any other factor, we just try to like mitigate that so that way they can access healthcare. You know,
That's a
health
really good
services.
way of putting it, actually. Because I mean, I know what you guys do, but at the same time, when people ask me, they're like, what does a community health worker even do? I mean, even employees still don't know
Yeah.
exactly
Yeah.
what you guys do because it's just so new and like there's not really.
We're like a bridge between the community and the health provider.
Absolutely.
Yeah. Yeah, that makes a lot of sense. So, transportation's one of the things, and Tina mentioned just a second ago when Tanner introduced you that you're a community health worker and health tran coordinator. Health tran, do you want to explain what that is?
Yes, HealthTran is a ride assistance to patients who does not have insurance rides through their insurance. Like Medicaid provides ride assistance. Some United Healthcare does. So these are for patients who does not have that opportunity. So we will take them to any, doesn't have to be Northwest, any medical appointment, because we don't want them to miss any medical appointments that they have.
Yeah.
So
And the way it's set up, it's interesting. It's like Uber services, but Northwest is that what the state that program is with?
the state has we have a platform which is run by Missouri Rural Association. Medicaid and them have MTM, which is an outsourced agency. They use Ubers, they use Oats. Now we just use volunteer drivers. So anybody out there that would like to be a volunteer driver,
Yes.
come aboard. I need a couple of more.
Yes, because like I said, Uber style, we have these volunteer drivers,
Right.
and they can make their own schedule.
They can choose what rides they want to pick.
And you organize all the rides. You call them and
I
do all the
put
scheduling.
them on the schedule. Stay in contact.
And it's a volunteer position, but you earn, is it 80 cents a mile?
Yes.
So technically you get
You
paid.
can. If you do the long distant ones, they add up.
Yeah, it's
For
more
sure.
worth it for sure.
Yep. And we do have long distant ones. Trust me. We have
Yeah.
a guy in Stanberry that has got lots of medical going on, and Merle, our faithful driver, he takes him, drives up to the Stanberry to Maryville, back, and then he sees our provider in Savannah. So it's just, it can add up.
Yeah,
So-
shout out to Merle.
Yeah.
Shout out.
If we
I
didn't
love
have him,
Merle.
He's great.
yeah, he is
Absolutely.
great.
I mean, he's taken our cancer patients clear to Columbia.
Yeah, I was gonna say. I feel like you told me,
Yes.
and that wasn't that long ago,
No.
that he took the patient all the way out to
and
Columbia.
he was even going to stay all night because it was iffy if the patient had to stay all night and be released the next day. So he
Uh-huh.
already had planned to stay in a motel, and he's such a good driver.
Yeah.
He's very compassionate and caring. He doesn't really do it for the money. He does it. He's just a really all right guy.
Yeah, and I mean, it's really like the perfect thing for somebody that's retired that wants to
Yes,
just like get some
yes.
part-time
Some
work in.
or just something to do during
Yeah.
the day.
And all you're doing is driving.
Absolutely.
Right.
Now, you do use your own vehicle.
Yes.
But that's where the 80 cents a mile comes in to help you pay for gas and,
Right.
you know, anything that
Yep.
you need help with. But it's a really cool program.
is, and it's
not been
getting-
around very long.
It hasn't. Maybe 3 years.
Mm-hmm.
I came aboard with the first platform, which was, and so we got it changed, and it's really running smoothly. We have lots of requests for rides.
Oh, I believe it.
Lots. We are really running them ragged. So come aboard.
Yes.
So if somebody's interested in becoming a HealthTran driver,
Get a hold of me.
we will put your number attached to the
Absolutely.
podcast.
We'll have Tina's number listed on the screen if you want to reach
Absolutely.
out. And yeah, like Corey said, you can make your own schedule, 80 cents a mile, and you're really helping people.
Yes.
You know, some people, especially here in St. Joe and other communities surrounding, you need a car. Like our cities are not walkable.
Yeah.
No.
Unfortunately, I really wish they were, but they're not. So it's really hard to get from point A to point B.
Absolutely.
And getting to your healthcare provider, it's important because then you're not going as often because you're getting the treatment you need now.
Well, and Mosaic has expanded. They're in Maryville, they're in Albany. So those rural areas is where they hurt for rides.
Yes.
So we kind of step in and kind of take over that void.
That's one of the biggest barriers we've identified is
Yes.
transportation, especially in rural areas. Oh, it's
Yeah.
really bad.
Absolutely.
I was going to say it goes right in with our mission, improving and strengthening lives through access
Yes.
to
Yes.
local high quality health care.
Right.
That program tackles that directly, providing the access to the health care.
And there's
Right.
times when the rides don't get picked up by the drivers. We have opportunity with some grant funding. We got a community health care car that we are able, me or Deanna or our team will pick
yeah,
up.
you guys
to
are cruising
select-
around in that thing. You know how many times I see you when
Yeah.
I get lunch?
Well, we're either taking a patient to and from.
Yeah.
So we pick up that
One of these
slack.
days we'll have to race.
Yeah.
I'm just kidding. So you do the HealthTran program for transportation. You also mentioned earlier that you guys help with food. So let's talk about that. What are some of the barriers to food for families out there, and what are you guys doing to help?
Well, I'm going to get ready to, and David's help too. I partnered up with the American Heart Association. I literally done that because they had some grant funds that they needed to disperse. So we have talked about, he asked me to ask some community partners to come in with us. So InterServe, the libraries, and there's one more. Oh, Social Welfare Board. We're going to put on, starting in hopefully the first Wednesday in August, we're going to start a pop-up pantry. It's called Pop-Up Produce. It's all fresh produce. It's just going to be good. We're going to set up every Wednesday at one of the libraries. So we're hitting
Okay.
all corners of the community. We're going to be, 2 of those will be open from 1 to 3 and the other 4 to 6 so we can get the working class parents and stuff. So,
Gotcha.
yeah, good things.
Yeah, that's awesome. And are you doing multiple locations all on the same day?
No,
Across
it's just
town, or
be
you're rotating?
one Wednesday a week. It will be at one library. So there's 4
Rotating.
libraries, so we'll be at one library.
So it's a once a week thing.
yeah, they
Okay,
can come to
cool.
whatever library they want, or once a month, whatever.
Cool.
We even have some employees. Libby, yay!
Yay, Libby.
She's going to give us our eggs,
Uh-huh.
Oh,
and
Good.
and she started a little garden for
She's
us.
always selling eggs.
Yeah, she
Yeah,
is.
she is.
Well,
I'm scared of them.
No, don't be. I eat them all the time.
No, they're good. They're
No,
good.
I
Yeah.
know they're good. I just, yeah.
Yeah, I mean, you gotta like wash them and stuff.
You can't wash them, Unless you wash them, you got to
Well,
refrigerate
Yeah,
them.
Tanner.
I gotta I can't. Yeah.
Well, then refrigerate them.
I
don't
do.
leave them out
I
on
don't
the
leave them
counter.
out. I gotta wash them because I.
But you can leave them out if you
can.
don't wash
Yeah.
them.
Yeah, I know, but I can't have that sitting.
Well, what do you want me to grow?
I don't care. Hey, any
Well,
produce.
Tanner and I will start a garden here.
Libby did for us. She did.
I thought about starting a garden this year.
Like
but
a
I
community garden.
didn't. Yeah. Well,
We tried to do one a couple years ago, but
Yeah.
I think King City's
No.
doing a community
It
garden.
never.
I'd have to talk
survived.
to Tammy Sparks, but I think
Yeah.
she
Yeah,
starts
King
one.
City has like big pots that they grow
That's good.
vegetables
Yeah.
in.
So she's hitting that
good.
area.
Yes, so that's good.
Mhm.
That's
So
awesome.
Tino, for this, can anyone come, or
Well,
what's the?
You know, there's Second Harvest. We didn't want to step on their toes because, you know, they open it up to everybody, their produce that they do. We really strictly wanted it to be for patients and community members who are really struggling. And we thought that is the food stamp application, people that have food stamps. Because they have cut food stamps tremendously.
yeah.
So
Oh, okay.
we are going to promote, if you have a food stamp card, come to the library, pick up some fresh produce. But if you don't, you can come one time and somebody's going to be there to help them sign up for food stamps.
Okay.
Okay.
Yep.
So it's an
So-
opportunity to get food and to
And
get signed up if
Yes.
you're not.
Absolutely.
Okay.
So that's what we're targeting, those
Okay.
people.
Yeah.
Not so much the whole community, because we're working on limited funds. But it's a pilot program this year, and hopefully we can continue it.
And Second Harvest, they're a partner of Northwest Health.
Right.
We just started back up the food drop at the Southside
Yes.
Clinic,
Right.
and that's the fourth Wednesday of the month now down
Yes.
there. But that one I don't think's limited. I think anybody.
Yeah.
Yeah.
That's why I said it's
through.
not. So
Yeah.
they're getting opportunity, these other people.
Right.
But I hear a lot of our food stamp, it's just not enough. They're cutting them.
Yeah.
Yeah.
And so we're hoping to help them a little bit.
Especially with the price of groceries
Yeah.
going up, you know, I
Yeah.
do see that
Inflation.
as a need as well. Food.
And so
you
they
know.
don't pick produce. They pick other things that are more sustainable. But
Yeah.
so,
But you got to get your fruits and veggies and
right.
Hearty grains.
Yeah.
Yeah.
So,
for sure.
That's awesome. And then, are you guys still doing the pantries at the clinics?
yes.
Yes.
Cool.
Yes.
How's that work?
Well, we haven't got too much in our little boxes, but we found some funds that we
Yeah,
have
that's
been
what I
able
heard.
to stock our pantry here at FMA,
Yes.
which any other locations are welcome to it. They just need to call us and we'll send them some.
Is that
their
for
way.
anybody, or is that there's
Yeah.
requirements that they have to have?
Especially, it's just our patients. They have to
Okay.
be our
So
patients.
come to our clinic when you are.
If we did a social determinant of health and somebody says, "Oh, I'm short of food," it doesn't, we'll offer them a food basket. A lot of our patients know that we have that, so they might call into either PCHH, their care managers, or me and David.
Okay, cool.
So the pantries at the clinics are for patients,
Yes.
and then the one you guys are starting on Wednesdays is
The
for
pop-up
anybody
produce
that's on food stamps
Yes.
or
In the
needs to
community.
apply.
Yes, that is
Okay.
a community effort.
And you're calling it pop-up
Produce.
Pop-up produce.
Pop-up produce.
Pop-up
And the
produce.
libraries
You
help-
guys remember MTV pop-up
Well,
video? Nobody remembers that?
I don't.
the
What
libraries.
in the world is wrong with you guys? I'm not that old.
No, you're.
And
only
we're
a year
going to
older
need
than
help
me.
with marketing.
Yes, Tina. I remember.
Yeah, thanks
we
for
had,
telling me.
I've just been waiting to hear more about it.
Yeah.
But we need to. Yeah, we'll talk more after because
Okay.
we'll need to get that rolling because it's
Right.
almost July.
And they want to see
I think we
it.
just steal the MTV marketing.
I think the people,
I'm serious.
they want to see a rough draft on our next meeting. So if we
When
could
is
get
it?
to, I don't know. It depends on when Tim decides to.
You know what we could do? We have the KC Bubbles party guy coming for the events in August.
Uh-huh.
We'll just have him put the life-size bubble over you, Tina, and we'll pop it with a cucumber.
Okay.
okay, marketing.
That'll be our little video advertisement.
So is that's starting the first week of
We're,
August?
well, the first Wednesday. We're hoping to get our money by then. and
Okay.
everything wrapped up, but it might
Okay.
be the second.
Well, we need to have a meeting. Send me
Or
an
if we
invite.
steal the MTV advertisement, it used to be like these little bubbles that floated on the TV, and we
Oh, I
could
know
put
what
your
you're
face in
talking
the
about.
bubble
Yeah,
and
yeah,
have you go
yeah.
pop up produce.
I'm gonna have to Google
Okay.
this.
Anyway, I think that's what it was, right?
I think so.
It was
Sounds
something
familiar.
like
something
that.
like that.
My
yeah.
memory might be failing.
So
me.
how the libraries are coming into it, which is great. They are going to allow us to set that up in the libraries, each library.
So you'll be inside.
Inside.
Hopefully.
Oh
yeah.
yeah, because it's gonna be hot.
Yeah.
Because yeah.
And,
Yeah.
Cool.
and with this grant money, we're going to he's going to purchase tables and chairs that we can leave in the library. We
Oh,
don't got
nice.
to carry them around.
Uh-huh.
And in turn, they've never had defibrillators in their libraries.
Oh.
So they were able to give them defibrillators, and
Wow.
so it's been a help to all of
Yeah.
the community. So it's exciting.
Are you guys actually in charge of it, or you said it was a partnership thing
Me.
with InterServe? and-
Northwest will, like we do the homeless walk thing.
Yeah.
We're going to oversee the money.
Okay.
So
Cool.
Awesome.
That's
Yeah.
great.
Yeah, that's wonderful.
So people come out. You have multiple opportunities
Yes.
to
Yeah.
get food
Yeah.
if you are in need of food. We have the
Absolutely.
second harvest on every fourth
Fourth
Wednesday.
Wednesday.
The pop-up produce every Wednesday
yeah,
starting in August. Look at
Yep.
our social medias for
and then
that.
if you're a
Yeah.
patient,
Uh-huh.
we have
advertising
pantries.
coming soon. Yeah.
Yes. Yeah. Patient, come. If you're a patient, come to a pantry if you need help. And
Absolutely.
contact
Yeah.
anyone in PCHH
Or CHW.
or
Yep.
CHWs
Or me and
Yep.
Tina.
or just Tina and David.
Yeah.
Okay, cool.
Okay. What else are you guys doing?
Yeah, David, what are you doing?
So I think not a lot. No, I'm kidding. So I think I have a unique perspective being at the Southside Clinic. There's a lot of Spanish-speaking people that live down there because of Triumph and like a lot of factories. So I do a lot of interpretation for the providers. You know, again, kind of just bridging that barrier between healthcare and language access. You know, since a lot of the times they don't really know how healthcare really works here in the States. You know, especially if they're out of the country. So I do a lot of that at Southside, which is like interpretation, kind of explaining that, you know, usually it's by appointment. This isn't an urgent care. You know, you're just kind of explaining the different aspects of healthcare. you
Yeah.
know.
Mm-hmm. And that's important because,
Oh, yeah.
I mean, people, you got to interpretate that for
Oh,
them. So you do you do that like daily usually?
Yeah, usually daily. yeah.
Usually multiple times a day?
Mhm,
Yeah.
yeah.
Well, that's good. We
yeah.
need that. That's really important.
It's definitely needed for sure.
Oh, yeah.
You know, like I hope someone would have, you know, would be here that speaks Spanish to be able to do that, like once I leave or whatever, you know.
Well, you're
Once
not
you
leaving.
leave.
Well, I'm just saying,
I
I'm
was
just
going to say,
planning,
you're not leaving.
planning for the future, you know.
Yeah,
David.
sure.
You have to go through me before you can leave.
I'm stuck. No.
Yeah, David helped us get a lot of our patient intake paperwork
You've done
transferred over to Spanish, and then we've done like some extra signage down at the Southside Clinic that's all in Spanish for that population to understand that clinic a little bit better.
And do you ever travel to other clinics if needed, or?
Yes. So my home base is at Southside, but I travel to North End every Thursday. FMA, sometimes I'll come down here to get some stuff. Gower, I visit Gower sometimes. So it's like my home base is Southside, but I go to other clinics as
Okay,
well.
so you're not just, so if you're needed elsewhere, if
Right.
someone reached out and like, hey, can you come next week?
Right.
You'll be here.
And that's what I like about this position so much, because every single day is different. You know, we're
Yeah.
just not. Oh, my glasses are making this kind of hard. Not every day is the same, and that's what I like about my job. You know, it's like I can help with passing out food, or I can, you know, help people do applications, and then one day I'm over here filming a podcast. You know, so it's like I love doing that kind of stuff.
Yeah.
Especially having like tables at events like the Merrill
Yes.
Boo Bash and like the HIV testing and, you know, Missouri
Yeah.
Western, that kind of stuff.
Yeah, which is great. Yeah, so CHWs also help with all of our events as well. So I'm the event coordinator. So we have a lot of events going on, and Corey and I cannot be at all of them, unfortunately. So the CHWs really help us go to those events and get the Northwest name out there and let people know what we offer. So yeah, you've probably seen David and Tina out more than you've seen Corey and I, but we
Well-
are all over the place. So
We're very involved with our community resource people.
absolutely.
And that's the whole point, is like the outreach aspect of it, you know, like being out in the community and actually interacting with community members, not being behind a desk the whole day, you know.
Yeah. Yeah, which is nice. I love, you know, sometimes you want to sit at your desk, and then other times like, let's get out there. Let's get out there and make a difference. So
Absolutely.
Another thing me and David are getting ready to do, we're getting ready to go through some schooling
Oh, yeah.
to learn to be diabetic instructors. And so once we get that under our belt, David will do events in the community and here on diabetic training, how to eat, and high blood pressure.
Oh, cool.
And so, and he will be there to help the Spanish speaking people. So he'll also learn it in Spanish. And So that's in the fire too. So
Because that's one of the main things we learned. Like when you take this CHW course to get certified, like the two main issues is
Your
high blood pressure and then diabetes. So that's one of like the two main.
Well, that's where we can step in and as
Right.
a community and get our patients in our community people educated.
Yeah, for sure.
Yeah.
I mean,
Mm-hmm.
a lot of people have high blood pressure, myself included.
Yeah, I
So
have
it's
it every
pretty
day.
common. Yeah.
When my kid throws a
and
tantrum.
that was another thing with working with the American Heart Association. He asked me, "Is there anything else I can help you with?" And I said, "Well, by the way, I said we need a grant for some blood pressure machines," and he gave us quite a bit of hunk of money, and so
Nice.
so we are able to continue giving our blood pressure machine to a patient who needs to monitor
Yes.
their
Yeah.
blood pressure.
'Cause that's
Which we-
important.
Oh yeah, we were giving out 3 to 4
Oh
a
yeah.
day.
Yeah.
So,
Wow.
It's important. I mean, I was told when I
Yeah.
was diagnosed with it, you need to be checking it
Yeah,
regularly.
Yeah.
absolutely.
And I didn't. But I'm glad you guys. So if you need one,
Yes.
reach out.
Let
Yeah.
us know. Hmm.
So that's I said, we're a resource of anything.
Uh-huh.
Medical equipment, food, and I'm even helping a lady she's been in the States for 23 years. She can barely speak English.
Mm-hmm.
She's all alone, and she's tried multiple times to get her citizenship
Mm-hmm.
because she so wants to vote, but she can't pass the test. So every week I'm spending an hour with her, teaching her the questions.
Yeah.
So it's whatever comes up.
Whatever
Uh-huh.
your patient needs, you know.
Yeah.
what
You
I
know?
mean? Yeah.
So we're a jack of all trades,
Mhm.
aren't
We
we?
really
sure.
are.
Yeah.
Yeah, we really
And
are.
David brought up Merrill earlier, and they are a resource that you guys use. So, so if we can't help a patient, say it's like out of our
Of
our
our
reach,
reach.
you guys continue to bridge that
Right.
gap to other organizations.
Yeah, we have a lot of resources in our
Absolutely.
bag.
So if they can't do it,
yeah,
they can find someone who does.
absolutely.
Exactly.
And so, could you explain what Merrill is, just briefly, so people know?
So Merrill is an organization that focuses on people with disabilities, whether that be like mental or physical. I do know they have equipment that they give out to help, with those kind of barriers, like if they need wheelchairs and canes and that kind of stuff. They're a really good resource. They're very knowledgeable. And again, kind of like what Tanner said, if they can't help you, they will redirect you where you need
Yeah.
to go.
It's Merle helps a patient with disabilities to be able to sustain their own living quarters.
Yeah.
So they don't have to go in a nursing home or that kind of thing.
Independent living.
Yeah.
Yes.
I think, yeah.
Yeah.
We went to their Halloween bash last
Yeah,
year,
it was fun.
It
That
was
was
very
fun.
fun.
Yeah.
and we had the fishing booth.
Yeah.
So, like,
Those kids love
That was
They
Tina's
did.
they threw
idea.
the
Yes,
fishing
Tina.
pole over the back seat, and then Tanner was hiding back there, and he
I
would
know.
like clip a
It's
bag of
because they
goldfish
can't
on it.
see what
Yeah.
you're doing,
Yeah.
and they love it.
Yeah,
That
there's like an
intrigue-
ocean barrier,
Yeah.
and then I just
We
like,
like doing things with the ocean.
yes.
That was an inside joke.
Okay.
So, only if we could be there right now on an
the
ocean.
On the beach.
On the beach.
Yeah, that would be fantastic.
Oh shoot.
I just have to find a community health worker conference.
I know. Hey, that conference is coming up, by the way.
Which one?
The one we all
The
went
rural-
to.
Oh, the rural
Yep.
health conference.
Yeah, are we going?
I don't know. Are you guys going?
Let's go.
I want to go.
Oh, talk to your boss,
Yeah.
and then if you're going, I might go. I don't
Okay.
know.
Yeah.
The main boss, is he going?
I don't know.
Well, we need
We
to
haven't
figure it
talked about
out.
We do.
'cause
August will
it's
be here for
July, almost July.
you. Yeah.
Well, talk to Mitch.
So, like I'm a patient at Northwest. What if I wanted a 6-pack?
A beer?
Yeah, no, a 6-pack, like abs. You guys are gonna help me get a 6-pack.
Well,
Six-pack?
I mean,
Are you doing that for your health? Or
Yeah,
you would.
I'm just kidding.
like,
I'm like actually
I
thinking,
thought
this
I'm
going?
thinking he was thinking, beer.
Beer.
I'm
Yeah, I
thinking
want
of
both.
actual resources. Like, where can I send him to?
I mean,
Well, you could go to the.
Oh, so you would just pawn me off?
What's some of
I
them
think I would,
fitness
yeah.
places?
Like
you
a
could
list
go
of all
to
the gyms.
Planet Fitness.
Yeah,
Corey.
Planet Fits.
There you go.
Fitness,
Yeah.
Corey.
Can you get me a free membership?
You could get a trainer over there, I hear.
I'm just joking. I'm just joking.
Oh, goodness.
Uh-huh.
Gosh.
Well, if you get one, if you guys get him one, I want one. So
I'll try.
David will paint it on you.
thanks, David.
He brings us 6-pack costumes. Here you go. I got off topic a little bit. So what else do you guys do?
Let's see. Helping somebody get their citizenship isn't
Oh
enough.
yeah, for sure.
Gosh, that is a lot.
Let's see.
What is the most challenging thing you've ever done without breaking HIPAA? You don't have to like tell us the person's name or anything, but what's like the hardest thing you've helped somebody with?
Ooh, I have one. This was pretty recent. This was a few months ago. I was helping a Cuban family that had just come from Texas. Again, did not speak a lick of English. It's a whole long story, but I ended up getting several organizations here in town involved, and it was like super good to see like everyone rallying behind this family. InterServe was involved, AFL-CIO, United Way. So the issue was that there wasn't many resources here for them. So kind of like, what Tanner was saying, we can't help you. That's kind of out of our scope of practice, since this family needed like a lot. They needed like immigration assistance. They needed like money, transport, a lot of different things. So make a long story short, we ended up reaching out to a church, United Way and they were able to help fund bus tickets to get back to Texas, since she had a family member there. And also Texas has a lot more Spanish speaking resources and that kind of thing. So it took about a month to get all that figured out, but it was amazing to see, all these organizations rally behind this family.
Yeah.
That's
awesome.
awesome.
It takes a village.
It does, yeah.
You
For
could have
sure.
sent Tina down with the company car.
I should have. I should have.
We could all went on a road trip.
Road trip, Texas.
Tina, why did you take you 3 weeks to drop those people off? She's down at the beach.
Well, that's awesome
Absolutely.
though that you got.
Yeah,
that
that is
family.
amazing.
So they went back to Texas,
Yep.
where there's more resources.
Yes.
So,
Yeah.
So
And they
okay,
had the
cool.
family members, so it was probably
Yeah.
a little easier.
Yeah.
for
Yeah,
you down
for
there.
sure.
What about you, Tina?
Well, right now I'm working on another Cuban. He's been here for 43 years. He's homeless.
43.
Dang.
He's homeless, and he does have his green card and a Social Security card, but he's had it for 43 years. It's so worn, and he got his ID stolen. That's a common thing when you're homeless on the streets. So I've gone around to a couple of the DMVs. They won't accept it because they can't even read his name on it. So my challenge is to get a new green card. Sets down now 2 years. So that means he will not be able to get housing because he has to have an ID. He won't be able to get any help without that ID. Can't get a birth certificate without ID. Can't get a Social Security number without an ID. It's just a racket race. So I have been calling around. I'm trying to get through to the immigration in Kansas City to see what maybe they could just give us a printout of his card
Right,
until
so
he
they
can
can
get
read
a
it.
new one. So it's just really challenging. You just gotta,
Yeah.
and I'm not saying I can do it, but
Yeah, but
Tina
you're
don't.
trying.
I don't stop.
No.
Yeah.
No, I really go to whatever extent I can to
Yeah.
help them.
You guys have to have a lot of patience. That's a
Yes.
lot of
A lot of hours worked.
Yeah, and it's
Plus everything else, because we also see patients within our clinics.
Yes.
Yeah.
Yep.
So
yeah. It's a juggling act
It
for
is.
sure.
It is. But
You
we-
guys are
but
the
I
only
love it.
two
Yeah.
community health workers
Yes,
we
and
have
we're-
at the moment.
Well, Darcy,
Darcy,
younger.
Chillicothe.
She's our new one up in
Oh,
Chillicothe.
yeah, that's right.
Yep, yep.
Sorry.
Yeah, just trained them.
I always
last week.
forget because she's technically with the R-Corp program.
Yeah, but she is going to be the CHW for that area.
Oh, okay.
Yeah.
So, just trained them, so hopefully they're doing good.
So now there's 3 of you.
Yeah.
Ideally, there should be a community health worker in every clinic, but that's, in a,
Yeah,
in a
yeah.
perfect world,
Yeah,
yeah.
yeah.
So they can come get their healthcare needs,
Yeah.
and then we're also there, on site to help,
Right.
with Medicaid applications, food stamps, that kind
Yeah.
of thing.
Yeah.
I
But,
do FMA, the MAT team, and Savannah and Mound City. But I don't visit those in King City. I don't visit them all the time, but I do check in to see, hey, what's your needs?
Yeah.
And I keep them on my schedule. So if I have to have somebody I need to call, I call them and do a social determinant of health over the phone.
Yeah.
But
That's awesome.
so
Yeah,
we
that's-
try to connect to all of our.
Yeah,
And so
yeah.
Darcy's going to do those outer clinics like Bramer and Chillicothe, Hamilton.
Canesville.
Yes.
And you guys work closely with PCHH too,
Yes.
but they're
Yes.
technically a separate.
Yes, they're
Team.
more medical.
Yeah.
Mm-hmm.
Yep.
You
So-
guys are more on the community side.
Side.
Right. A lot of
Absolutely.
our job duties overlap. Like we both do
Yeah.
repair assessments, like screening for
Yeah.
social determinants. Also help with applications and stuff like that. But,
But
a lot.
mostly they come to us.
Mm-hmm.
Hey, can you help this person?
Yeah.
Yeah,
Yeah.
Which
like
is
you said,
okay.
you're a jack of all trades.
Which is okay. I
Corey
love
needs a 6-pack. Go talk to Tina.
Planet Fitness.
Or it could just be a
On this
simple.
episode, we are sponsored by Planet Fitness.
Yeah.
You get a free trainer.
Right.
I don't know about that.
Okay, yeah.
Their numbers just sail through the roof.
Yeah,
at St. Joe.
skyrocket.
You'll have to cut that part out.
We're not cutting anything. I'm just kidding.
Anyway. So yes, we do a lot of things. It's hard to just put it all in one
Yeah.
one
Mhm.
sentence because like I said, I would never dreamed I'd be helping somebody get their citizenship.
Yeah.
You
Yeah.
know.
Yeah.
She's a patient of ours. It affects her stress level.
For sure.
So she's not healthy because she's stressed every day about this, that she can't learn it. But her barriers are she doesn't speak our language very well and she can't read or write. So
Yeah.
Or I even have a patient who simply is kind of sad, so he requested that I call him every single day, just kind of check up on him, like informal, you know what I mean? I'm connecting him with counseling services since I do think he needs that, you know. But it could just be something as
Yeah,
simple
he's-
call in the morning. Hey, how are you doing? Do you need anything? You know.
Yeah,
Yep.
for sure.
Yeah. I mean, that's understandable.
So you guys are clearly essential and very, very important to this company and the communities
Yeah.
that we serve.
and their CHWs are becoming popular
Yes.
over this state. They're and you guys could even our company could even since we're credentialed, you could get paid for some of our services.
Yes.
I mean, they're really evolving
Yeah.
throughout the
Even here in St.
Country.
Joe, like Social Welfare Board, I think they just hired like 3 new community health workers.
That was my next question. Does anybody else in town have
Oh yes.
Oh yes.
have them?
United
Yes.
Way also hosts the meetings for support
Yeah.
workers
Okay.
every month as
Yeah.
well. So we all get together, kind of
Yeah.
discuss different barriers, how we can help each other, that kind of thing.
CAP has them in the schools now.
Okay.
Oh,
Yep.
That's really cool.
that's needed for sure.
Yeah.
I'm glad they're finally realizing how
Important we
important
are.
Right.
we are, you know. We could even help with the money side of things, you know, and then just
Yeah.
we do a lot. We do a lot.
Yeah.
We really do.
I see it. I know.
I was gonna say something a second ago, and it went out of my mind, but it will come back to me. Oh, I got it. Last year we did the Adopt a Family,
Oh yes.
so we do stuff like that too, and that was around Christmas time.
And that family was so appreciative.
Yeah, that was really fun. We'll have
It
to do that
was.
again.
And that involved all of our people in the organization, which they all came through. It was just so cool.
I just think it's cool that we have people working here full time that basically their job is just to help people.
Yeah.
Yep.
And it like employees like Tanner and I who work in marketing, we don't get to do that stuff a whole lot. We do here and there, but it's just nice to know in the back of your head that there's people every day constantly doing this stuff that we're supporting by what we're doing too. And I don't know, it just leaves you with a good feeling.
It does.
Absolutely.
It does, yep.
Like when you put your head on your pillow at night,
Oh yeah.
it's like, I get paid to go to work and help people. That's pretty cool.
Yep.
Yep.
Very
Well, it's
gratifying
very
work.
satisfying.
sure.
Yeah,
and
gratifying.
it is. It's, I helped a MAT patient came here. He was awful, and he was on the streets. Just got out of jail. He within I say 5 months. I asked him where he was going to go that night, and he didn't have a plan. I said, "Why don't you go to PP? It's probation and parole." He did. He got successfully through that program. We got him housed, and he's got a job, and very eager to go back to school.
Wow.
That's awesome.
So that is so, to take somebody from that.
Yeah.
And he calls me all the time and thanks me. I treated him like my son. One day he picked up cigarette butts off I was taking him to get a driver's ID. And he picked up these cigarette butts off the ground. And I said, "Drop those. Those are nasty. I'll buy you a pack of cigarettes."
Yeah.
Right.
So he remembers that, but he's thankful.
Uh-huh.
You know.
Mm-hmm.
I said,
Yeah.
"Don't ever do that again." So I was treating him like my kid, but
Yeah.
it worked.
Yeah.
Yeah, some people you do kind of have
Yeah,
to
you
treat
do.
them like
Yeah.
a
Like-
kid, you know.
I mean, it just came out of me. It's like, don't do that. I'll buy you a pack of cigarettes.
Yeah.
So what was funny is I went to Casey's and I bought him a pack of cigarettes and a lighter. Well, Janet that works here, her husband's seen me and he knows me. And so he asked Janet, he says, "Does Tina smoke?"
I saw that Tina over there. She
Where's
was buying a
cigarettes.
for a patient. Yeah.
Oh,
I know that's not
7 bottles
healthy.
of wine.
I know cigarettes are not healthy, but picking up something that was in somebody else's mouth
Yeah.
is more dangerous
Oh, yeah.
than buying
Yeah,
them a
you
pack
don't
of
even know what's
cigarettes.
on it.
Yeah.
So
So
That's just like a.
and you have to fight one battle before you can move to
yeah,
the next.
for sure.
That's just like the Needles for Needles program that
Yeah.
we learned about down in Simpa.
Yeah.
Didn't you guys go to that?
Uh-uh.
or-
No.
I didn't.
No.
So we went down to Simpa in Chattanooga, Tennessee last year to examine their HIV program. And they have a program, I think it was called Needles.
Janet went with you.
Yeah,
Oh,
Janet went.
Janet.
I think it was called Needles for Needles. I might be wrong, but they basically post up in like a parking lot and they give out free needles to drug users in exchange for them
For
turning
turning
in
in.
their used needles. And it's like controversial because people are like, well, you're just
Yeah, but you're not throwing them on the street.
Yeah.
yeah, people are like, you're just
So a little kid pick
helping them
up
do
or
drugs, but it's like, well, they're gonna pick up the dirty ones off the street
Right.
and use them.
Yes.
that or somebody that a curious kid. Or
Yeah.
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 And it's actually been proven to
Successful.
successful people are healthier and
Well,
they,
yeah,
there's
they're
not as
you're
much
not getting,
infection.
Yeah.
Yeah.
there's-
Right, right.
It
Absolutely.
reduces that for sure.
Or if you are overdosing, aren't there people on site that would be able to help, right?
Oh,
Yeah.
I'm sure.
Yeah, you know.
Yeah.
So instead, you don't overdose like on the street.
So it's just like you said with the cigarettes, like this
Yeah.
person was gonna pick one up off the ground that was used and smoke it. It's like,
Yeah.
okay, just take a new cigarette.
yeah,
You know, instead of getting infection or some or
COVID.
sick
Absolutely.
or yeah,
Yep.
something like that. So kind of the same concept.
Yeah.
Well, you guys are doing a lot of wonderful things.
Yeah.
Yeah.
And you've got the pop-up produce starting in
Yeah, I'm
August, so we'll have to
excited.
send out more information about that.
Yes.
We'll come up with some funny advertisements.
Yeah.
Um,
Sorry, I volunteered you guys.
No, I remember us talking about it, Tina. I just wasn't sure.
We're on a short budget, but we want to make sure this gets off the ground.
Alrighty, we can
yeah,
do
for
it.
sure. And then you're doing the health train program for transportation, and you guys are doing all the other stuff we've talked about here today. So
Yep.
I think it's amazing. Is there anything else you guys want to mention on today's episode? Anything you can think of?
Just don't judge a homeless person. When you see one out there on the street, you don't know where they've came from or what they're dealing with. It's not all about drugs and alcohol.
Yeah.
You know, they do use that stuff. That's just to numb what they have to go through. I think I would too if I had to live
Oh yeah.
on the streets every night and be afraid of what, you know. So let's just think about them because they're the ones that are less fortunate, not us.
Yeah.
So, and we are all one step away from that.
Oh,
Yep.
yeah. Yep.
I agree for
So,
sure.
That's just my take.
I just want people to have empathy because people
Yeah.
don't really think about that kind of stuff. Like Tina mentioned, something as simple as not having an ID. You know, now you
Yeah.
can't work. You know, so
Yeah.
now you don't have
And they
any
think
income.
it's easy
Yeah.
that they can just get a job.
It's
Well, it's
very
not that
hard.
hard. It's hard for them because, like I said, you got to have this to get this and this, and they can't even get a birth certificate without an ID.
And we can help people get birth
Yes.
certificates
Absolutely.
and IDs through the Homeless Walk funds that
Absolutely.
we raise every year at the Homeless Walk, the Walk for the
Yes.
Homeless in November.
Yes.
And you guys partner with Mark Dobbs on
Yes.
that.
Absolutely. Mhm.
So that's been a really cool program. I actually just talked to him last week. We raised enough money the last 2 walks that he's got more than enough
Yes.
right now. So we're hoping that we just carry that
Yeah.
momentum year to year
Absolutely.
and are able to do more and more.
And I'm understanding now that it can be anybody that needs, not just a
Anyone.
patient.
Yeah, it that kind of got like confused
Confused.
through the years by somebody that was here, and
Yeah.
we got that all cleared up. And so anybody, it doesn't
Yeah.
have to be a Northwest patient, can
Absolutely.
utilize those funds to get a copy of their ID,
Yes.
birth certificate, whatever. with Mark Dobbs and you guys too. So
Yep.
Tina, what is your phone number? Do you know it off the top of your head?
Yes, 816-752-7130.
So, and people can call you.
They're needing a ride and they
They're
don't
needing
have ride
something.
assistance through insurance. Absolutely.
Okay.
And sometimes I will take, the acutes that don't have 3-day notices, but they're acute. I will make sure they get here.
Okay.
Awesome.
Cool. David, you have anything to add?
Nope.
Okay. Well, thank you guys for being on the
Yeah.
episode today. I
This
think
was
this is
great.
really helpful information for the community to listen to, as well as our staff even. So yeah, thanks for being on.
Thank you for having us.
Yeah.
Absolutely. Tanner, you want to do the closing?
Yeah, I'll try to do the closing. Thank you for watching this episode of The Pod presented by Northwest Health Services. Thank you to Tina and David for sharing all the information and amazing things that you guys do for Northwest and our surrounding communities. So we applaud you on that. And be sure to check out our social medias for updates about our pop-up produce and other events that we have planned in the future. And yeah, don't be afraid to reach out to David or Tina. We will have all their information listed below.
Thank you.
Sounds
Alrighty.
good.
Don't
Thank
forget
you
to like
guys.
and subscribe.
Like and subscribe.
Thank you, David. Like I said, he's our biggest fan.
Yes.
All right.
See you guys.
Bye.
Bye,
Bye.
guys.